Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class we are going to discuss with the embryology MCQs of the block C, that is cardiorespiratory system. So first MCQ in today's class is the respiratory diverticulum initially is in open communication with the primitive foregut. Which of the following structure is responsible for separating the two structures? That may be the bronchopulmonary segment, the laryngotracheal groove, the laryngotracheal diverticulum, the posterior esophageal fold or tracheoesophageal septum. So the correct answer is tracheoesophageal septum. Here you can see in this diagram, this is the part of the foregut and this is the esophageal, this is the tracheal tube, and this over here is initially called the esophageotracheal ridge, which later on forming the septum and separating the esophagus and the trachea from each other. So this is tracheoesophageal septum. Next is greater part of the left atrium is derived from the left horn of the sinus venosus, the right horn of the sinus venosus, the greater part of the atrial chamber, left half of the common atrial chamber, or the pulmonary veins. So we all know that most of the left atrium is formed from the pulmonary veins, while original main atrium forms the right atrium. So here correct option is pulmonary vein, that is E. Next MCQ is developmentally the right horn of the sinus venosus give rise to the options are the rough part of the left atrium, rough part of the right atrium, smooth part of left atrium, smooth part of right atrium, or rough and smooth part of the right atrium both. So we all know this area is called the part which is derived from the sinus venosus, also called the sinus venereum, and this is the smooth walled part of the right atrium which is derived from the smooth walled part of right atrium which is derived from the sinus venosus. So D is the correct answer. Next MCQ is morphologically the development of heart is essentially completed by how many weeks post conception? That is 4 weeks, 6 weeks, 8 weeks, 12 weeks, or 16 weeks, and correct option is the 4 weeks, that it is completed 4 weeks post conception. Next is most common type of the congenital heart disease is either tetralogy of Fallot, coarctation of aorta, the ventricular septal defects, the transposition of the great vessels, or pulmonary stenosis. So we all know this is a very common question in your exams, and most common of the congenital heart disease is the ventricular septal defect, that is C is correct option. Next is components of the blood-air barrier in the lungs are derived from which of the following sources? Either ectoderm only, or endoderm and ectoderm, visceral mesoderm and ectoderm, or visceral mesoderm and endoderm. So we all know whenever we describe that the respiratory system is derived from the endoderm, we are discussing about the development of its epithelial lining. The rest of the structures, that is cartilages and the muscles and all other surrounding structures of the respiratory system, are derived from the visceral mesoderm, also called the splenic mesoderm. So in this case the blood-air barrier is formed by the visceral mesoderm and endoderm, because components from these two structures are responsible for formation of the blood-air barrier, and this is the answer. Next is respiratory diverticulum, that is lung bud, appears when embryo is approximately 2 weeks old, 4 weeks old, 5 weeks old, 6 or 8 weeks. So correct option is 4 weeks old. When embryo is 4 weeks old, the respiratory diverticulum or the lung bud appears. Next is regarding various type of the esophageal atresias or the tracheoesophageal fistula. The commonest type is the upper esophagus ending in a blind pouch, and the lower segment forming a fistula with, so it is maybe duodenum, right bronchus, left bronchus, trachea, or stomach. So you can see from this diagram that this is the trachea with which it is forming the fistula, and this is the correct option. Outer wall of trachea is formed by ectoderm, endoderm, mesoderm, hypoblast or neural crest cell. So as I have already told you that outer walls are formed by the mesoderm and basically the splanchnic mesoderm. So C is the correct option. Next is regarding maturation of the lungs. The alveolar period ends by 1 month to 2, 3 to 4, 6 months to 8, 7 months to 9 or 8 months to childhood, and this is the answer because alveolar period continues after childhood till the 5 years of the life, and this is the period when maturation of the lung is continuous, and it is the correct option. Next is respiratory distress syndrome mainly affects the vocal cords, the trachea, the right bronchus, left bronchus or alveoli. A very simple question. The respiratory distress syndrome affects the alveoli and this is the answer. Next is in which part of the respiratory system the gaseous exchange takes place. So we all know this is the alveoli where the gaseous exchange is taking place and this is the answer. Next is the most superior part of the inferior vena cava is derived from. Most superior part of inferior vena cava is derived from the left vitelline, the right vitelline, the right umbilical, left umbilical and sinus venosus. So this is the most superior part of the inferior vena cava and it is derived from the right vitelline vein. Next is embryonic origin of the ligamentum arteriosum is from second arch artery, third, fourth, fifth or sixth. So here you can see this is the sixth arch which is forming the ductus arteriosus and which after birth form the ligamentum arteriosum. So ligamentum arteriosum is basically derived from the sixth arch artery and this is the answer. Next is of the following one of the most closely associated with the portal vein is the umbilical vein, umbilical artery, vitelline vein, third aortic arch and sixth aortic arch. So here you can see the anastomosis around the duodenum is formed by the vitelline veins and this is later on forming the portal vein. So portal vein is related with the vitelline vein. Ostium secundum defect, it is characterized by large opening between left and right atria. Yes. May be caused by excessive resorption of the septum primum. Yes. May be caused by inadequate development of the septum secundum. Yes. May be accompanied by intracardiac shunting of the blood. So these all options are true. So the correct option is E, that is all are correct. Next is closure of the foramen primum results from fusion of the septum secundum and fused endocardial cushions, septum secundum and septum primum and the fused endocardial cushion, the septum primum and septum spurium, septum primum and sinoatrial valves. So we know this is the septum primum which is growing downward and it fuses with the endocardial cushions to closes the foramen primum. So the correct option is C, that is septum primum and fused endocardial cushions. Next is crista terminalis is derived from the right horn of the sinus venosus, the left horn of sinus venosus, primitive atrium, AV canal or right cusp of the valve of the sinus venosus. So these are the cusps or valves of the sinus venosus and this one is the right venous valve or right cusp of the right venous valve and it is forming the crista terminalis. So this is the answer. Next is esophageal tracheoesophageal septum separates the laryngotracheal tube and the nasopharynx, esophagus and nasopharynx, laryngotracheal tube and esophagus, laryngotracheal tube and oropharynx, esophagus and oropharynx. So correct option is it is separating the laryngotracheal tube from the esophagus. So here you can see also this is the esophagus and this is the laryngotracheal tube which is separated from each other by the tracheoesophageal septum. Next is cartilages and muscles of the larynx are derived from a very important MCQ. Most commonly it is present in exam. So the cartilages and muscles of larynx are derived from either first and second pharyngeal arch, second and third, third and fourth, fourth and fifth, or fourth and sixth. This is a very common and very important MCQ, and answer is fourth and sixth pharyngeal arch. Next MCQ is that the incomplete fusion of the embryonic endocardial cushions can produce which of the following congenital defect? That may be tetralogy of Fallot, coarctation of the aorta, pulmonary stenosis, atrioventricular septal defects, or transposition of the great vessel. So most commonly it affects the atrioventricular septal defects, and this is the answer. Next MCQ is in fetal circulation. The ductus venosus carries blood from inferior vena cava from the umbilical artery. So here you can see this is ductus venosus. This is the inferior vena cava and the ductus venosus, which is carrying the blood from umbilical vein and not the artery. Then ductus arteriosus carries blood from right ventricular to left. No. The foramen veil permits blood to pass from the right to the left ventricle. No, it is from the right to the left atrium. Inferior vena cava contains oxygenated blood. Yes, it contains oxygenated blood, and ductus arteriosus is not non-contractile. Again, it is not true. The ductus arteriosus is contractile in nature. So correct answer is D. Next MCQ is in case of the pregnancy at high altitude, the hypoxia causes which of one of the following cardiac anomaly? That is patent ductus arteriosus, the tetralogy of Fallot, the atrial septal defect, ventricular septal defect, and coarctation of the aorta. So remember, this is a very important MCQ from the exam's point of view, most commonly present in exam, and answer is the patent ductus arteriosus. Next MCQ is ductus arteriosus developed from 6th aortic arch, 3rd, 4th, 4th, 1st, 4th, or 5th. So here you can say this is the 6th aortic arch from the ductus arteriosus, from which ductus arteriosus is developed. So option A is the correct option. Next is lesion of the conus cauda will cause all of the following except the atrial septal defects, the cyanotic congenital heart disease, ventricular septal defects, stenosis of pulmonary trunk, and right ventricular hypertrophy. So we all know the conus cauda is responsible for formation of the conotruncal septum and also separating the outflow tract, which is also responsible, and it is also responsible for formation of the septum in between the ventricles and also responsible for the outflow tract. So these all four are due to the lesions of the conus cauda, but ASD is not because of the conus cauda. Next MCQ, and this is the last, which structure is involved in formation of the outflow tract of the two ventricles of heart and maintenance of aortic and pulmonary blood flow? That is aorticopulmonary septum, the AV cushions, the bulbus cauda, the septum secundum, or the septum primum. So we all know the outflow tract is basically formed by the aorticopulmonary septum, and this is the correct option for this question. Thank you very much for your attention for today's class. Best of luck for your exam, and Allah Hafiz.